So I'm Andrea. I'm from Occupational Therapy, and I'm going to talk to you today about occupational therapy's role with you after your spine surgery. We look at activities of daily living. So one thing we'll go over today is how to get dressed, especially your lower half. We'll also look at safety, getting up and down from your toilet, in and out of your shower or your tub shower. We'll work with you with whatever you have at home. And then we'll also go over how to get in and out of a car, all while maintaining your BLTs. And that's no bending, lifting, and twisting, not the sandwich. So before we get into that, what I'd like to do is have you go through your home and set it up for safety. So you may or may not be using a walking device after your surgery, and we just don't want you tripping over anything in your home. So take the time now to pick up any clutter from the floor, any loose throw rugs, roll them up and temporarily remove them. And then what I'd like you to do is go through different areas of your home that you use a lot, especially the kitchen, and do some rearranging, especially your pots and pans that you keep down low. You want to have it waist height so you don't bend. Also in your refrigerator, do some rearranging so you can access the things you need to easily without bending. Also, you may take a look at your bedroom, do some rearranging there. If you normally keep clothes in low drawers, rearrange it so it's waist height. Okay, so take the time to do that now before your surgery so your environment is set up for safety and success for you. Other things to talk about are pets. So if you have a animal or a dog or cat at home that you normally take care of, we suggest that you have someone help you with the care of your pet. Because most of the time we keep the food dishes and everything on the floor, and again, you do have that bending restriction, so it's just best to have someone else take care of them initially. Other things to talk about is we do encourage walking after your surgery, but please don't hold the leash of your pet, because even if your dog is a great dog, there is that tendency of twisting, and that's one of your other restrictions. So walk, but walk with someone who's holding the leash of your pet, not you. Okay? Other things to consider is the doctors ask you not to sleep with your pet because they just don't want to find any kind of hair or anything in the bandage which could cause infection. And then lastly, they ask you to not let your pet lick your incision, again, just to avoid infection. So let's get into lower body dressing. So after your surgery, you do have a bending restriction, and oftentimes people say, well, what is that? Well, often I tell people you can reach to your knees. Anytime it's knees down, we consider that too much bending. So a couple of ways to dress your lower half is if you have good body mechanics, you know, your shoulders and hips aligned, and you're able to flex your leg up like this, you certainly can get dressed this way. So you can put your socks on this way, your pants on this way, without bending forward. Another way to do it is if you keep your shoulders and hips in alignment and you're able to maybe get your leg up on a bed or a sitting surface like this. You can also reach to your sock and pants this way. So that's another way of doing it. But notice my hips and shoulders are mirroring each other, not twisting. And if those two methods are difficult to do, there's also long-handled equipment. And there's a whole array of equipment out there that can help you. One piece of equipment that I recommend to all spine patients, whether or not they have good flexibility, is getting one of these. So this is a reacher, and just because of gravity, everything tends to fall to the ground. So if you have a featherweight reacher like this, it's a nice handy thing to pick something up from the ground without waiting for someone to do it for you. It also can be a handy tool for getting dressed in the morning. So I'll give you a quick demonstration. You can use it to take off your shoes without bending or twisting, and take off your sock without bending forward. So you can see how handy that can be. It also can be handy for getting your pants on in the morning. So oftentimes I teach people, if you have a leg that's a little weaker, you want to put that weaker side in the pants first, okay? You're going to clip your reacher to the waistband of your pants, just drop them to the floor, and then you're going to lace it up over maybe your weaker leg first. Pull it up to your knees. Once it's to your knees, you can grab it with your hands, right? And then you can do the same thing for the other leg. Bring it back down, get your other leg in there, so you get the idea of how it can help you get your pants on. Another handy piece of equipment is this. This is a sock aid. This can be helpful for putting your socks on. How it works, often I tell people, is imagine this is your plastic foot. So this is the toe end, and this is the heel end where the strings are. And what you're going to do is you're going to take your sock, and you're going to pull it over your plastic foot, just like you would your own foot. So you're going to pull it over this. You want to make sure the toe is snug at the top. Pull it down, and then make sure the top of the sock is straight all the way around to the bottom of the knots. Then you're going to just lower this down to the floor without bending forward. Get your toe in there, and with the gentle pull on the strings, voila, your sock is on, all without bending forward or twisting. Another helpful tool is a long shoe horn. So this can be helpful along with using the reacher to put your shoes on. There are things like elastic shoelaces, as you see up here in the slide. You don't necessarily have to go out and run out and buy those. You could just be like me and tie your shoes loosely so it's easy to slip on and off. And then if you pull the tongue of the shoe back, start with using the reacher. Clip the reacher at the tongue, bring it down to the floor, get your toes started, then take the reacher out. Grab your shoe horn, line that up with the heel, and slide your foot in. And voila, your shoes are on, all without bending, lifting, and twisting. The other thing your occupational therapist will go over with you is safety getting up and down from your toilet. So if your toilet is very low at home, people usually have the tendency to bend too much forward and push too hard with their arms. So I suggest you go home and practice getting up and down getting up and down from your toilet, and make sure that you're limiting your bending and limiting your pushing with your arms. You can use your hands lightly for balance, but again, we don't want you pushing more than 10 pounds through your arms. If you are having difficulty maintaining that good body mechanics with your low toilet at home, oftentimes I will suggest investing in a high toilet seat. So those are readily available out in the community. They even carry them at Fred Meyer's for about $20. And again, it'll give your toilet a little extra height, so it will make it easier to get up and down without bending forward. Okay, so we will practice this with you while you're here in the hospital, and we may make suggestions depending on what you need. Okay, other things that we will look at, and I know this is very personal, but is after having a bowel movement, many people tend to bend forward and twist to clean themselves. And again, those are two of your major restrictions. So what I'd like you to do now before your surgery is practice having good body mechanics and see if you can reach back there to clean yourself. If you can, great. If you find that you're struggling or that you're twisting too much, you may invest in something called a toilet tissue aid. You can even do something like this. These are barbecue tongs from the dollar store. These work great also. But what you're going to do is put the toilet paper in here, and you're going to wipe front to back. Then open it up, and the paper will fall into the toilet. And that way you don't twist for cleaning yourself after having a bowel movement. So again, go home and practice, and you'll have a good idea if this is something you will need. And again, these things are all available either online, you can get them from Amazon, or at medical supply stores. They would also carry something like that. The other thing your occupational therapist will go over is how to get in and out of either your tub shower set up at home or your walk-in shower. And there is a special way the spine surgeons like us to teach you. So if you have a tub shower combination, this is just to simulate the height of an average tub. So it's whether you have this setup or a walk-in shower setup, it's the same way. What they like you to do is face one of the walls of your shower or your tub, and you can lightly put your hands on the wall for balance if you need to, and then you're going to sidestep up and over that lip. Okay? And that way it eliminates a lot of twisting. And once you're in your shower, just be mindful that you take little steps so you don't twist while you're in there. Other helpful things that will be a good addition is making your own soap on a rope. And that is getting an old nylon, cutting it off at the waist, putting your bar soap in there, and tying the one end to your wrist. And then that way, if the soap falls to the ground, you can pull it up. Because again, you do have that bending restriction. Other things that are helpful in the shower is getting a long back brush so that you can wash from your knees down. Because again, you do have that bending restriction. Okay? And then to get out, again, face one of the walls, one leg up and over, then the other leg. And if you have a walk-in shower, it's the same idea. You're going to face one of the walls, side step over, same technique.